You are now live.
There we go. Okay, it's being live streamed. We are live. And committee, this is Senate Finance, March 15th. We are going to start going through the S bills that have been sent to us. Some of them are as simple as there's a fee or there was a fee in the underlying bill. This one is not that simple. It got sent to us from Health and Welfare because it really is about insurance and the health insurance markets. And Jen.
Yes.
Welcome.
Thank you.
Starting out, there's two different, there's Medicare supplemental and there's Medicare. They're two different kinds of insurance. Can you just explain to the committee what the different kinds are, and so we know what we're dealing with here?
Sure. Good afternoon. Jen Karby from the Office of Legislative Counsel. And so as we go through the bill, you will see that there are two different types of insurance that go either along with or instead of Medicare that we're talking about. And so often in your committee, we're talking about Medicaid. In this case, we're talking about Medicare. And the bill, underlying bill is about Medicare supplemental insurance policies. So those are policies in private insurance policies that are largely regulated at the federal level, but that people would purchase to go along with a traditional Medicare plan, so Medicare A and B and Part D. And the supplemental plans usually help with out-of-pocket expenses, and they may, that's generally what they're there for, is to help make using Medicare more affordable. The other option is for an insurance plan is Medicare Advantage plans. Those are sometimes called Medicare Part C, and that takes the place of original Medicare and Part D. So it's instead of enrolling in Part A, Part B, and Part D of Medicare program, you would instead purchase a Medicare Advantage plan that would offer all of the traditional benefits from original Medicare and Part D, and may also include additional benefits as well, but there may be some other pieces to them that people aren't as familiar with around availability of network, for example. And just like with Medicare supplemental, in fact, more so with Medicare Advantage, this is really regulated only at the federal level. So it's not these, DFR has some role in rates for Medicare supplemental in our existing law, but they do not have any role in Medicare regulating Medicare Advantage.
Okay. So we can't tell them that former football player can't be advertising every 20 minutes, at least on the channels I'm watching.
Right, there is language in here to look at ways to provide some education to the public, but that does not involve, likely does not involve limiting the advertising or marketing of Medicare Advantage plans.
And if you take a Medicare Advantage plan, because it gives you dental and eye service or other things, there is a penalty for coming back into Medicare?
Yeah, and I might have Mike Fisher explain to you some of this. You have a window for signing up for a Medicare supplemental plan and for Medicare, traditional Medicare. And if you don't sign up for a supplemental plan within the 6-month period after you turn 65 years of age, so you either didn't sign up or you did, I think, a Medicare Advantage plan and then decided to go back and do original Medicare with a supplemental plan, you may end up paying an additional amount for your Medicare supplemental plan for the rest of the time you're on it. So likely the rest of your life, because you missed that original 6-month open enrollment. And so that's some of what this bill is looking to address.
Okay, so why don't you walk us through the bill?
Okay, so this is S239. And it is, and you should have a strike all amendment from the House, I'm sorry, from the Senate Health and Welfare Committee. I think we had a little little mix up about which version you're looking at. So you may need to, Faith and I talked about maybe putting it up on the screen, or she was going to have some delivered from.
All right, this doesn't say it's a strike all.
No, this is the as introduced version. that
Okay.
we have.
Don't look at the as introduced version. I mean, you can, but I was planning to walk through the Senate Health and
Something's
Welfare.
starting to print. Oh, that's cute.
Senator Cummings, this is Faith. My apologies. The version is coming from the copy room any minute now.
Okay, so the new version is coming from the copy room.
Do you want to wait, or do you want me to put the language up on the screen?
Why don't we put the language up on the screen
Okay.
and we can keep going because we've got a pretty heavy agenda. We have a chairs meeting at 4.
She makes that signal.
Can you make that, we're getting 2 pages at once. There.
I know, I just made it bigger so you won't.
Yeah,
I'll make it even bigger. How's that?
okay. I tested the optometrist this time.
Okay, I can make it significantly bigger. You just let me know what you
Go
want.
for it.
Go bigger.
Okay,
Yeah.
Okay, now I can see it through the middle of my glasses. That'll work.
all right. All right, we're at 200% now. So it's filling up my screen. It's great.
Okay.
Okay, so now we are looking at the Senate Health and Welfare strike all amendment to S239. Section 1 would amend the existing statute on Medicare supplemental plans, which are rated using community rating. And this would add some provisions, the first of which would require that a health insurance company, hospital or medical service corporation, or health maintenance organizations, or different insurer types. So, and we'll say broadly, an insurer offering a Medicare supplemental insurance policy under this language must guarantee acceptance of an individual's application, so can't turn anybody down, for coverage during the 6-month period following the individual's 65th birthday and during an annual open enrollment period that would coincide with the federal open enrollment period for Medicare Advantage plans. So this would create an annual open enrollment with guaranteed issue during a period that coincides with the federal open enrollment period for Medicare Advantage. It would also prohibit an insurer who is offering a Medicare supplemental insurance policy from making any premium rate distinctions or charging any additional fees or penalty amounts based on an applicant's failure to enroll in a Medicare supplemental insurance policy during the applicant's initial open enrollment period when they turn 65. So this is creating the annual open enrollment period with guaranteed issue, and also saying there can't be a financial penalty for not having signed up during that original 6-month open enrollment period.
Could I ask a question?
Yes.
Jen, is it the fact that that you can't enroll prior to your 65th birthday? Like some people would be, not me, but some people would be organized enough to enroll a month or 2 before they were turning 65 in order to ensure coverage and all that. And this language doesn't contemplate that, but I'm just curious if you could help me understand how those people would navigate this.
That's a great question. I don't actually have an answer to that. I don't know if any of the other witnesses do, but I will make a note to look into when that open enrollment period opens.
Thank you.
Jen,
Right.
question about shall not make a distinction in terms of charges.
Yep.
What's the original motivation for this? Was this an adverse selection provision originally? You know, like, oh, you passed over the chance, now you've got a bad doctor's visit, and you say, oh, I better get on a plan, so it's an adverse selection protection or something.
I think that's exactly it. I think it's to require people to sign up during a particular period when they are, so that they don't wait until they need the coverage to sign up. And this would create an annual open enrollment period. So it wouldn't be open enrollment all year, but it would create a window where people could get in if they hadn't originally, or if they had switched, if they were switching from a Medicare Advantage plan. But yes, I think it is exactly that, adverse selection.
I think we're going to hear more from Blue Cross Blue Shield.
Okay,
Other questions?
So there's made a note of that question. Subdivision 2 would require an insurer offering a Medicare supplemental insurance plan or policy. And I will note, you may also hear these referred to as Medigap. So Medicare supplemental insurance and Medigap are the same thing. So an insurer offering a Medicare supplemental policy must allow an enrollee to change at any time from one Medicare supplemental plan to another plan or policy offering comparable or lesser benefits. You couldn't buy up, but you could buy something sort of equivalent or with lesser benefits if you'd already enrolled in one plan. And subsection E directs the Department of Financial Regulation to collaborate with health insurers, advocates for older Vermonters and for other Medicare eligible adults, and the Office of the Healthcare Advocate to educate the public about the benefits and limitations of Medicare supplemental policies and Medicare Advantage plans, including information to help the public understand issues relating to coverage, costs, and provider networks. So that's the insurance coverage piece, and we'll look at the effective dates at the end. But before this takes effect, as I recall, I'm sorry, this would take effect, yes, on July 1st, 2023, because in section 2, we have a study and a report, or a sort of working group and a report. Section 2 would direct the Department of Financial Regulation to convene a group of interested stakeholders, including representatives of the Community of Vermont Elders, the Area Agencies on Aging, and the Office of the Healthcare Advocate, to consider issues relating to the availability of, enrollment in, and use of supplemental coverage by individuals enrolled in a Medicare or Medicare Advantage plan. A majority of the stakeholders would not have any financial stake in any Medicare supplemental coverage or Medicare Advantage product. This directs the stakeholder group to examine first the options that are available to older Vermonters under 65 years of age with end-stage renal disease, which is another eligibility category for Medicare, and Vermonters under 65 years of age whose disabilities make them eligible for Medicare, and that's the other Medicare eligibility group. So the options available to people who are eligible for Medicare through Medicare Supplement and Medicare Advantage plans, the affordability of these options, and the extent to which the state may regulate or otherwise affect the options offered to Medicare beneficiaries in Vermont, including the marketing and advertising of these products. The effects of, and this goes to Senator Braid's question, the effects of annual or continuous open enrollment periods for Medicare supplemental coverage available in other states, including whether they have led to adverse selection or higher rate increases, or both, and the extent to which an open enrollment change for Medicare supplemental coverage would be likely to increase access to affordable coverage for eligible individuals and to reduce medical debt. Whether Vermont residents are receiving accurate information about Medicare supplemental coverage and Medicare Advantage plan options, and sufficient assistance with selecting products that are in their best interests, and if not, how best to remedy that situation. And finally, the reasons that some Medicare beneficiaries do not have secondary coverage and the policy options available to increase their access. This would require DFR to provide its findings and recommendations, including any recommendations for changes to Vermont law, to this committee, the Senate Health and Welfare Committee, and House Healthcare by January 15th, 2023, with Section 1, the insurance coverage piece taking effect on July 1st of 2023, and then the rest of the bill taking effect on passage. So let me know if you want to take this down or go back to any language.
I think our bills have arrived, so you can take it down.
Okay, great.
Okay, committee. Any questions? So this bill sets up an annual enrollment and allows people to switch during that time.
Right, it would allow somebody to sign up or to switch.
Or to switch. And it then sets up a study, which the study results will be in before this switch takes effect, right?
Right. The study results would be in January. So if there was anything that you wanted to change as a result of that before the open enrollment piece took effect, you could make those changes.
Senator Pearson.
Madam Chair, I think my question is kind of for you since Senator Hari's not here, you're the only one on the morning committee, but we've been doing this thing lately where we make a change and then sort of immediately study whether or not we should make that change. And I guess, what was the discussion like about, I'm sure you noticed that as you guys voted this out.
I think from a healthcare point of view, the more healthcare people could get, probably the better.
Yeah.
And there is some, very heart-wrenching stories that we heard about people that couldn't switch. The offsetting factor was the impact on the rates on everyone and the impact on the insurance market, which is why it got sent here. And I think when we get to Sarah, who was next, she's going to give us some information on why they're so concerned about what allowing this potential adverse selection could do to the rates for everyone. So I think that's what I've gotten, because she's submitted her testimony in writing. It's on our website, and so we'll hear from Sarah, and then we'll hear from Michael, and then we'll just quickly decide what to do.
Quickly?
Very quickly. Okay, Sarah, the floor is yours.
Thank you. So this is Sarah Teachout. I'm representing Blue Cross and Blue Shield of Vermont, and I did provide the committee with a letter that I'll go through. I'm not going to read it, but I'll go through at a high level, and then I have a few other comments and additional information that might be helpful for the committee. So Blue Cross and Blue Shield of Vermont does have serious concerns about the impact of the change to allow an annual open enrollment period in Medicare supplement plans. And it's exactly for the reasons that you were discussing. The federal policy encourages people who are Medicare eligible to purchase their policies early when they turn 65, within 6 months of them, or retirement, or there's a few other specific situations where they're allowed to purchase. This is followed by the majority of states and limits adverse selection. So this committee has talked about adverse selection many times in the past, when you can get people to purchase their insurance policy when they're still healthy and not wait until they're sick. The whole stability of the pool is better, and the prices can be lower for everyone. So it is true that purchasers who miss that window or change their mind at a later date do face larger hurdles to purchasing insurance, and it's usually a higher price. There are a handful of states, mostly in New England, I believe Idaho recently made a change, that allow either annual or continuous open enrollment. And many of them are paired with restrictive regulations, such as one piece you have in this bill, which limits the transfer to a plan of equal or lesser value. And some prohibit transferring from Medicare Advantage plans into Medicare supplement plans, and that's not considered here. So I'm sure this does seem harsh to people who missed the deadline and want to switch plans, but it also does encourage people to buy early and not wait until they're sick or they have significant healthcare needs before they purchase coverage. And that's the way that Medicare supplement plans are kept at a lower premium rate, by having this limitation in law. So the piece that's unique about Blue Cross and Blue Shield of Vermont is that we actually offer two types of Medicare supplement plans, and more recently Medicare Advantage. So we offer Medicare supplement plans under the federal rules, where you have to enroll in the open enrollment window. And then we offer Medicare supplement plans that any person can purchase anytime at any day of the year in any medical circumstances. So you can purchase these plans. They're called Medicare Blue 65 plans. You can purchase this plan from your hospital bed. You can purchase this plan if you've just received a diagnosis of cancer. You can purchase this plan if you have end-stage renal disease. You can purchase it anytime. The premiums are higher and they reflect that difference. So the reason Blue Cross offers those plans is a little bit historical. It's because traditionally we were the safety net insurer for the state of Vermont, and we used to be required to cover lots of people who couldn't get insurance in the regular marketplace. So these plans are a little bit of a holdover from that time. So on page 2 of my memo, I show you a comparison of the premiums between the Medigap Blue, so those are the less expensive premiums, and they're for people in the open enrollment window, and then the Vermont.
Put that up because some of it would just be easier, I think, if we could all see it, because some of us only have one computer here, and we have to get off to get. We don't have a computer. Can you share?
I don't think I can share on your screen.
Okay, Faith, can
Sorry.
you share or let Sarah?
I'm happy to share. Sarah, tell me what you want me to pull up.
So it's my memo,
Okay.
not the email, and it's page 2. There's a chart across the middle of the page. It says Blue Cross and Blue Shield of Vermont Medicare Supplement Plan Comparison. I'll keep talking while Faith finds the document. Thank you.
got it?
Perfect.
Okay,
So it's the one in the middle,
one has New York and then
the
the
smaller.
other.
Yep, perfect.
Okay,
So Vermont Medigap Blue, these are the ones that you can only enroll in your open enrollment window that's currently allowed by the federal government. And the second one, Vermont Blue 65, you can enroll anytime. Because Medicare supplement plans are highly regulated, the alphabet letter at the top indicates exactly the benefits in that plan, and the insurance company cannot deviate or change the benefits. So a plan A is directly comparable to a plan A anywhere and in any state, with the exception of Massachusetts. But so the plan A plans are identical, same with C, D, E, and F. So the only difference in these plans, because these are both Blue Cross and Blue Shield of Vermont plans, are the enrollment rules. It's the same company offering them. We have the same overhead. We have the same customer service. We have, all the things that might differentiate a company are not, this is sort of a perfect example, are not different between these plans. So it's just the
Hey,
different.
can you pull
enrollment
that up a little bit more? It's the top one we're looking at right now. Yeah,
Yep.
can you make that a little larger?
So I could just give you the example. I'll pick D in the middle, Medicare Supplement D.
That's good.
If you enroll in the open enrollment window, it's $165.72 per month. If you enroll, if you miss your open enrollment window and at any other time want to have Medicare Supplement Part D from Blue Cross and Blue Shield of Vermont, you would pay $268.38 a month, which is almost 62% higher premium. And I believe that the way that the Medicare supplement plans work, the A plan has less generous benefits and coverage. And then as you go out to G, the benefits and coverage are more comprehensive. And so that's why you're seeing the prices go up, except for G might be one that's no longer allowed. I can't remember.
Senator
So-
Siraki. We have a question, Senator Siraki.
Sarah, so when you pay the higher rate, if you miss the deadline, do you pay that higher rate for life or just for that year?
You pay it for the rest of the time you're covered under the plan, correct?
And you can't switch to another plan ever?
You can switch, and we heard some interesting testimony in the other committee, but then the insurance company will evaluate your health status and offer you a premium based on your situation. So it's usually health status. So generally it would be higher premium.
Okay, so this is based on the assumption that if you didn't sign up at 65 and you waited until you were 75, that there's just given age, you're going to probably need more insurance and you haven't paid in for 10 years. And B, that the likelihood that you just got a bad diagnosis or you're starting to feel chest pains increases. So the likelihood that you're going to cost more is what's driving and I'm sure your actuaries.
They take all that into account. The one thing I would say is that Blue Cross and Blue Shield of Vermont does not do any of that evaluation. That's not part of our business at all. We offer two plans. One, you come in under the federal enrollment window, which is usually 6 months within your birthday, or you can come in at any time and we don't ask any questions.
Okay.
So I can keep moving if that's helpful. So
I've got Sandra Bray and then Senator Pearson.
Ms. Teachout, good to see you. So what happens, have you looked at data elsewhere that suggests, I mean, I know there's always the potential for adverse selection, someone delays adding coverage, but there's other reasons that people don't add coverage. For instance, I've talked to people in the last 2 years that tried to get counseling from like the OEO's office, like agencies on aging, et cetera. And they were told that offices were closed, no appointments were being booked. And then frankly, I think the system is pretty confusing for someone who's been paying in for healthcare all their life to find out that they actually don't have what they thought for a coverage. So they're not even sure what kind of gap they're trying to fill in. So I'm sympathetic to based on conversations I've had, and especially in the last 2 years when it's not been business as usual. So I'm just wondering, yes, there's always the potential, but have we seen it anywhere? Are we protecting against something that's hypothetical as opposed to demonstrated through past experience?
Sure. So I'm happy to give you our perspective on that. There are, and I have some data on how many Vermonters don't have secondary Medicare coverage that might be helpful. But I think we see two reasons, perhaps, that people are not purchasing secondary Medicare policies. One is sort of the mistaken belief that Medicare covers all your health insurance needs. And once you turn 65 and qualify, that you don't need to pay for health insurance anymore. And I think that's a fairly common misperception. And I think a second one is cost. Many people, as we know, and the elderly, especially in Vermont, are low income. If they haven't planned to have the resources to pay for a Medicare supplement plan, they may not be able to afford one. And that's actually one of our biggest concerns with what you're doing here in the bill as it's currently drafted, that if you raise the premiums, the Medicare supplement premiums, you may cause more people to be unable to afford these policies while giving some people more choice and more opportunity to sign up later. But if it's still unaffordable, even if they've missed the deadline or they didn't realize they needed to buy it earlier, making it more expensive will make that more difficult.
Okay, Senator Pearson, you had a question.
My question had to do with your chart. It wasn't actually linear in terms of the prices increasing. So I wonder if you could help me understand that.
Yeah, and I would need to look up what that one plan is, but they're reflective of the benefits. And I do know that the federal government changes some of the plans and discontinues some of the letters. And so you're right, they're not linear. So I need to I need to answer that question for you. I can't do it right now.
Thank you.
So Sarah, do you want to go on, are you ready to go on to your
Yes.
second chart, which I think may answer some of Senator Gray's questions?
Okay.
Because that was a state comparison, right?
Right. So we tried to look at other New England states and indicate in the chart. So I have on the left the state. We picked Plan G because it would have been a pretty complicated chart to pick all the alphabet ones. You could pick any of them and see relatively similar outcomes. Many other states rate people on their gender or whether or not they're smoking and their age. Vermont does not, because we have community rating, as you all know. So I have a box here that says if the state allows an annual enrollment and if they have community rating, because those are pretty big factors in the price of insurance. So we looked at the premiums for Vermont for those plans and then tried to compare them as close as we could. And I think a study, a more comprehensive study might be helpful, but this was what we were able to do to show what the premium differences are. And there aren't many charts with health insurance premiums that show Vermont on the low end, but this one does. You'll see that the prices in Vermont are the same no matter what your age is. In New York, same, but the lowest price in New York is higher than ours, $226 instead of $145, and their highest price is $533. Maine also clearly has no age rating, so their lowest price is $200 and the highest is $372, so a little bit more than ours. I would note that Maine has some more stringent limitations on the switching during their annual enrollment. Then Connecticut, their range is 191 to 618. And they have both an annual enrollment and community rating. New Hampshire does not have annual enrollment and does not have community rating. So they're the ones that you're going to see the differences based on age. So I won't read them all, but you can look at it. And then Rhode Island has annual enrollment and no community rating. So like New Hampshire, theirs are a little bit lower than ours on the bottom end, but not necessarily for the highest price plans. So it's, I think, and the one thing that I can say is that a Plan G plan is the same in all these states. The reason Massachusetts is not on here is they have state-specific plan designs, so you can't compare them. So in this overview, we see that Vermont's prices are pretty favorable, and we attribute most of that to limiting the enrollment to the annual open enrollment, and then having a Blue Cross plan that anyone can enroll in anytime. So I'll go through the rest of the memo, and then we did offer some suggestions that can be looked at in the study group for ways to change the system that wouldn't have quite the same negative impact that the current proposal has. So, and then the other thing I would note, and Senator Pearson brought it up, is that this presupposes the outcome of the study and has the open enrollment going into effect in 2023, I believe, 2024. So, how much we're able to do in the study group, when you've already changed the law, there's always the possibility of coming back and reversing what you've done, but I think it's less likely if you've already put it into statute. So a couple of other pieces of information that I wanted to offer that may be helpful is so this is 2022 data, 156,000 Medicare eligible Vermonters. So this is a much smaller population. It's about 18%, I think, of the total population in Vermont. Of those, 82,000 roughly have a Medicare Part D plan. So we know that they've purchased secondary drug coverage. And about that has dropped over the past 5 years. And the reason that has dropped is because we've had such a dramatic increase in the number of people choosing to purchase a Medicare Advantage plan. So about 41,000 Vermonters have a Medicare Advantage plan right now. That was only 14,000 5 years ago. So it's been a very large increase. So therefore, using those numbers, we can estimate that about 21% of Medicare eligible Vermonters do not have secondary coverage. That is a big concern because your out-of-pocket exposure can be huge if you don't have secondary coverage. Just two things to note. Some people who are technically eligible, so over age 65, may still be working at a full-time job that offers them health insurance. Some may have TRICARE for life, which is available for veterans, and they don't need to purchase these plans. Or some may be covered by a younger spouse. So if you are over 65, but your spouse still is covering you under their insurance plan, you might not need a secondary Medicare plan. So the 20% is probably a little bit high, but it still is higher than we see in a lot of other states. There is, and because we got into the Medicare Advantage discussion, I would note that there is a rising popularity of Medicare Advantage plans, and that nationally, half of all those with secondary coverage have Medicare Advantage. The primary reason for that, we believe, is that Medicare Advantage offers zero premium plans. So if you are income limited and have very high concerns about the premiums, you can often get a Medicare Advantage plan, which will cover your drug costs, some additional things that typically aren't covered under a Medicare supplement plan, and have your out-of-pocket exposure limited. And so that's one of the benefits of Medicare Advantage. There certainly are other pros and cons to consider. And so two other things that I will mention, because they've come up in the discussion when comparing Medicare Advantage and Medicare supplement plans. Medicare supplement, you can go to any provider that accepts Medicare. And so it's generally, almost every provider. With Medicare Advantage, there's two plan options, but they're based on networks. So a preferred provider organization network, which is called a PPO, you pay less for your in-network care and more for your out-of-network care with those plans. And HMO, you must get your care with the in-network providers. In the past, my understanding is that Medicare Advantage plans often had the HMO limitations. And so people were frustrated when they couldn't go to the provider of their choice. The newer plans tend to have PPO plans. So they encourage you to go to the in-network provider, but they allow you to go to out-of-network providers at a higher cost. So some of the unintended consequences that we are concerned about in this bill is if you raise the prices for Medicare supplement plans, you could be increasing the number of people who do not purchase secondary coverage through those plans, or you could force more people to move into the Medicare Advantage marketplace because they have $0 plans. And the last thing, I think we'd want to look at it in the study, but national carriers could choose to leave the Vermont marketplace because of our unique rules. Now, I know there are a handful of other states that do have those rules. And I'm not saying that everyone will leave the marketplace, but it could have some impact on the number of options for Vermonters. So those, I think, were the main points I wanted to make. And I see there's questions, so I'll stop.
Yeah.
Sarah, it sounds like it's this adverse selection is driving your opposition, and it just I guess I wonder, there's a big range between enrolling in your first 6 months of being 65 and enrolling when you're sitting in the hospital and you've just had a heart attack. Are there states that have found a way, or your partners around the country that have found a way to offer something somewhere in the middle that could deal with this affordability concern in a different way and not put Blue Cross in the position of taking people right when they're about to be very costly?
Well, I mean, I gave those examples for the Medicare 65 because that does occur. We also get people who miss the deadline and by a year. I have heard of people who signed up for those plans when they're over 90 years old. So I'm not exactly answering your question, but what the proposal in your bill does is merge the two plans that we currently offer into one. So we would still have the same pool of people, they would just be merged together in one pool. And so the rates would be higher for people who enrolled within the window and maybe slightly lower than our highest plans for people who miss it. So that's one thing. You could require every insurer that enters this marketplace to offer an annual enrollment plan. You're losing something with moving to the annual enrollment and gaining something as well. So with an annual enrollment, like is proposed in the bill, you have to wait until the open enrollment window to join a plan. So you can't do it if you just find out that you're sick or you have a healthcare need, you have to wait. And that works more like the ACA. Ours is actually more flexible than that. We prevent people from having those sort of catastrophic needs by allowing them to enroll right away when they feel that they need coverage. So, there's trade-offs here. And I guess our plea is please don't put it in law right now. Do the study, look at all the options, and we can come back as a stakeholder group with proposals for you to consider. But we do see pretty significant consequences to some of these choices.
What about, does anyone offer in other states, a different option if you enroll before you're 70? I mean, it just seems like you've given us two choices in the current universe. You don't like the third option that's here. And it seems like there could be several other ways to get some of what the bill is trying to do. I'm just curious.
Yeah, I'm not aware of a state that does that. I mean, even extending the window from 6 months to a year wouldn't be as consequential as this one that's wide open. But I'm not aware of a state that does that, but that doesn't mean that there isn't one.
But what I think I heard you just say is, don't make the decision now. Do the study and see what the study brings back, and then make the decision. And you can write the study to look. Okay.
That is our request. I think one other thing that I failed to mention is that right now there's no filing deadline for Medicare supplement rates to the Department of Financial Regulation. So my understanding is that the premiums are kind of published not all on the same day or at the same time, and they may not all be available for the open enrollment window. So that was another idea that we talked with DFR about if they established a deadline for the rate filings, then all the information would be available to consumers at the same time. And I think with some education and information, DFR could provide more information to consumers.
Okay. Yeah, to me, the difference between Advantage and supplemental, I knew both of them were out there, but yeah, I don't know. I had to go look at my Medicare cards to see what I had. And that's me. So Ruth?
Thank you, Madam Chair. Thanks, Sarah. I'm sorry I missed the beginning of your testimony. I was across the hall, but you just alluded to something, and I'm confused. What about your either your proposal or your other option? And I don't remember how you phrased it, but I'm not sure what you're talking about. Are you talking about a different? So Blue Cross Blue Shield has Medigap plans that the A, B, C, D, whatever. And then you also have supplemental plans. Do you have something else too? Did I miss something?
You missed it.
So we have Medicare supplement plans, two types. One that follow the federal enrollment window guidelines that are the less expensive ones, and ones that are completely open. You can enroll anytime, at any age, in any health situation, and they are more expensive for the identical plan.
Okay, so I think that may be what you were referring
You've got
to.
the chart on her,
The
It shows-
chart on your,
on.
It's on page
Memo.
2 of the memo, and it's the smaller chart.
oh, I see, okay. I see.
Okay, I'm gonna try and get to Michael, because I don't want to cut him short for time. So, Michael, floor is yours.
Good afternoon. Good afternoon, committee. Mike Fisher, healthcare advocate. I think you won't be surprised to hear that the advocate's office has a bit of a different perspective than Blue Cross's. First, let me just say that the HCA has been working on this bill, this concept, for a while. We get cases regularly from people, from Vermonters who are struggling to get coverage, either because they fall into the category that Blue Cross described, they thought they were covered, and they discovered when they got sick that the 20% cost sharing was just not what they understood. So we do get cases like that. The other category that I think has not been discussed so much here so far is it's not uncommon that we get Vermonters who call us who have signed up. Yes, Madam Chair, they listened to a former football star who promised them that the Part C plan was the best thing ever, and they signed up for it, and they discover when they needed some care that it doesn't meet their needs, and so they want to come back to a traditional Medicare plan and get coverage, and discover that they're being penalized. Not just penalized for a month or 2 months or 5 months, but for the rest of their lives. On a high level, it's the oldest trick in the book. Everybody knows it. Rates are lower if you keep sick people, if you keep segments of the population out. Equally so, everyone in the world of insurance knows that there's a real risk to the pool if you let people sign up for insurance when they get sick. You don't sort of, either of those extremes doesn't meet our needs of covering people. And that's why the bill before you doesn't do either of those things. It seeks that middle ground that I think Senator Pearson suggested. An annual open enrollment period is the tool we use all over the place in healthcare to find the balance of just not locking people out for the rest of their lives, and also asking them to plan, asking them to make a decision, not when they get sick, but once a year, to sign up for health coverage. We do that, as has been mentioned, in the QHP, in the individual and the small group. We do that is done in the large group. Even employers do that when they're asking people to sign up. It's the basic tool. And so that is what we suggested in this bill. And it is not comparable to say, a couple of the states that were referenced earlier, Connecticut and New York, have continuous open enrollment periods, my understanding. And so it's not comparable in my mind to compare what's proposed in this bill, an annual open enrollment period consistent with Medicare Part C open enrollment periods for Medigap plans. The bill as introduced had the annual open enrollment period start next year. That's what our proposal was. That continues to be what I believe is the right balance point between access and avoiding adverse selection. The committee down the hall, and the two of you sit on, Senate Health and Welfare, I think.
I turned him up.
Oh, you turned him up. All right, we have power. Some people are having trouble hearing you, Lou.
Oh, I'm sorry. Should I start over?
No, no, we pick you up.
Ruth and I
The
will-
committee down the hall changed the effective date for the annual open enrollment period to postpone it for a year. I suppose I have to be responsive to that. That was, I believe, DFR who said, hey, you should study it before you make the change effective. I'm going to recognize that as a reasonable adjustment. But I continue to believe that that an annual open enrollment period is the right tool to find the balance between the two.
Michael, about the 19 to 20% that have no secondary coverage, because that's been part of the concern. A lot of them don't because they don't have the money or they don't know. And if we raise, and it sounds like we could be raising the base premium, that's not going to help them.
So one point I'd like to make about that is that I understand that when you're talking about insurance pools, you're talking about this segment of people and the money in and the money out for them. As the advocate for all Vermonters, I want to recognize that people who don't make it in during that 6-month period, they still get sick. They still get care. And I would suggest that a decent amount of those costs are borne in the hospitals, by the hospitals as uncompensated care. So that's just one point to make about it. But then I also want to recognize that a lot of the comparison that's been provided to you so far today has been comparing our current 6-month open enrollment period with a continuous open enrollment period. And that's not I don't understand that comparison. Nobody is suggesting that here today. Or I'm not suggesting that here today. I see a question.
Yep, Senator Hardy.
Just one quick question, Mike. You said, I think I heard you say that we changed the open enrollment period to be consistent with Medigap, Medicare Part C. And I think it's in the bill, it's Medicare Advantage plans.
I apologize. If it wouldn't be Medicare if there weren't two terms for the same thing.
So we changed that in health and welfare, I believe, because it started out as Medicare Part C and we changed it to Medicare Advantage because it aligned better. It was actually, yeah.
And I'm just saying that we are both right here. Medicare Part C and Medicare Advantage are the same thing.
Oh, they are the same thing. Okay. I stand corrected. Thank you.
No, you were right.
Okay. Any other questions for Mike? Senator Brock.
This is probably a more general question. One of the things that you mentioned was the problem of the person who buys a Medicare Advantage plan and then finds somewhere down the line that it's inadequate for his or her needs. Is there adequate education or disclosure that is clear enough for the average person to understand about the limitations of Medicare Advantage plans?
No. And I take this on a little bit, Senator. I regularly have the experience of watching the advertising for Medicare Part C, Medicare Advantage plans, and think, wow, it's my job as the advocate's office to be educating Vermonters about the challenges that Vermonters have with these plans. But there is a tremendous amount of industry, of resources that go into that advertising. And so while we attempt to do public messaging about this, my little shop is a tiny, tiny little blip in comparison to the constant public messaging that comes out about Part C.
You should get a few football players.
Senator Gray has a question.
Well, Mr. Fisher, can you fill us in? Is there a state, we were talking about the illustrations, the comparisons aren't for what the bill proposes. Continuous open enrollment versus an annual open enrollment period. Do you have any data that shows what happens to a state that moves from the status quo to an annual open enrollment period so that we can judge rate impacts more accurately, maybe?
So I would caution us to not put all of our analysis in one state. The one state that's, I believe, listed in the Blue Cross memo that has an annual open enrollment period is Maine. But I also understand that Maine also has some other differences from Vermont. So
equal or lower
right.
value
So
plan, you couldn't move up.
So, I guess I have just, I want to revert to sort of my most basic message. The costs of this care are borne by the system anyway. And that, getting everybody into a guaranteed issue plan is the right tool with the appropriate protections from adverse selection. And I'll continue to say the annual period is the way to do that. That's the right tool to do it.
Senator Bray, you had the floor, and then I'll go back to Senator.
So I have a Medicare beginner's question. If you work past 65, don't you continue to pay into Medicare? Or do those premiums cease to be deducted?
I'm sorry, I didn't hear.
If you work past 65 and you have wages, do you not continue to pay in federally to Medicare?
I don't know exactly the answer to that question, but it does raise one point that I want to make sure to cover here, and that is that people have an interest in buying or an availability to buy a supplemental plan after both they have turned 65 and they buy a Part B plan. And people are not apt to buy a Part B plan until they've stopped working, until they don't have coverage from an employer.
Okay, well, so I guess I'll have to find out more. I'm just wondering sort of where those post-65 Medicare premiums paid in paycheck by paycheck are going. I don't know that they enrich your Medicare program. So what are they being applied to?
That's a good question.
Okay, Senator Brock.
I'm going to pass on my question.
Okay.
Yeah, can I just want to emphasize, I barely mentioned it. I want to emphasize again, we have a changing landscape in Medicare. The numbers of Vermonters and US citizens that are experimenting, exploring the Medicare Part C plans is a tremendously growing number. I have heard the estimation that Vermont's going to reach 50%. And it wouldn't surprise me.
Plans, right. Part C is the Advantage plan.
Yes, and that is a significant change. And the bill before you provides a bailout, an opportunity for people to not be stuck with that decision without getting a penalty for the rest of their lives.
Okay. Senator Pearson.
Could you say all that again and pretend that I don't have a clue about the differences between everything you just said? I get that there are different programs.
Yeah.
I get that people are shifting, but what does that have to do with this? And like help orient me to that concern, please.
So for the person that buys I'll just call them a Medicare Advantage plan, the person who buys one of those and who discovers when they get sick, and I'm just going to say, a year and a half out, They
Right.
discover that, they needed care, and they discover that the plan they bought and that they're paying premiums into doesn't meet their needs. Maybe there's no providers available to them. That person, if that person wants to go back to a traditional Medicare plan with a supplemental plan, they're stuck paying the increased costs in the supplemental plan. This bill would provide them an annual opportunity to make that shift and get the guaranteed issue.
That's where they can transition. That's where the language, that's what we're talking about. So is that more important than the forever open enrollment, maybe, given the shifting landscape?
It's a prime motivator for us, for sure. I'm not sure it's equally important, maybe I'll say.
Senator Brock.
But that change would have an effect because the money would have to come from somewhere to make up the difference. And that difference would come from the person who enrolled at age 65 in standard Medicare with a supplement, whose premiums would have to rise to make up the difference, wouldn't it?
The cost of the premiums will reflect the cost of administering and paying for the claims.
I mean, if more than 50% right now, people fall into that first category.
Yeah.
And the system isn't going to pay for it, people are going to pay for it. And so the premium would have to rise. All of those people who followed the rules and started out doing what everybody recommends they do.
I guess I understand what you're saying, and there's some truth to it. I just want to remind you that for those people who didn't quite follow the rules, maybe they didn't understand it, or maybe they purchased a Medicare plan and it didn't meet their needs, that those people still need care, and those costs are still borne out in the system, often as uncompensated care that's cost shifted to the rest of us.
Okay,
I did steal a plug.
you did steal a
Yes.
plug. That's, all right. I have an iPad that's about to close down. So, but we've got circulating plugs here. All right. It is mine, but that was my plug. It was plugged in. It's having a place to plug it in. That's the problem.
Oh, there's one underneath.
No, we do not need to crawl under the table.
Right in front of you, Madam Chair.
There is one, but it doesn't fit easily. So we will keep going, but I may lose faith. All right.
Don't lose faith,
I don't
Madam
lose
Chair.
faith. No. All right, Senator Bray.
I just sort of want to raise a flag around this expression, people who didn't follow the rules. I think there are a lot of people that didn't elect, maybe the right choice in retrospect in a timely way, but I don't know that they were not following the rules. My experience is that it's anything but clear that someone says, here's the rule book, and, follow this rule book. It's a transition that a lot of people have figured out on their own. And what I've seen, the transition can be pretty uneven in terms of the kind of information you get and when you get it. So it sounds like people are being scofflaws, and I don't think that's.
Yeah, that certainly was not my intent.
No, I don't.
By saying that, what I did was following on the comment that Mike was making,
Right.
that we don't have very good education to let people know what they're getting into, and particularly with respect to purchasing Medicare Advantage plans in the first place, that there are downsides to those plans. And I don't get a sense that we do a very good job of alerting people to those pitfalls.
Okay, I've got one more witness, so this is getting into committee discussion. I want to get to Elizabeth Lively. If no one has any other questions from Michael. Okay, so we're going to Elizabeth Lively, and Elizabeth, thank you for being here. And just tell us about some of the situations that you think this might help with.
Thank you, Madam Chair and members of the committee. I really appreciate the opportunity to provide our testimony from dialysis patient citizens on S 239. I can't really add any more information to what Michael Fisher so aptly has talked about, the challenges that patients receive when they realize that their Medicare Advantage plan doesn't meet their needs, or they have inadvertently missed that window. And so we do support that section of the bill that would provide an additional open enrollment window. But I wanted to specifically just take a few moments to comment on the study provision, which now does include taking a look at what is available for under age 65 Vermonters who are eligible for Medicare because they've been diagnosed with end-stage renal disease. You may or may not know that Vermont statute currently provides access to individuals under age 65 who have a disability diagnosis, but specifically excludes end-stage renal disease patients from access to purchasing Medigap. In Vermont, there are 815 individuals with kidney failure. 428 of those are under age 65. And these are individuals that either need to take dialysis treatments 3 times a week or get a kidney transplant to stay alive. Kidney failure doesn't have a cure. You're on dialysis or you get a new kidney through a transplant. Other than that, those are your 2 options. The out-of-pocket expenses for the dialysis patients are extraordinary. They can be up to $20,000 a year. So it's pretty easy to understand why Vermonters would spend down their assets to qualify for Medicaid. That way they become a dual eligible Medicaid and Medicare. That way the state is picking up that 20%. Regarding transplant, it's interesting to note that without a supplemental insurance coverage, you are not going to be listed on the active kidney transplant wait list. This isn't because the transplant programs are hungry for money. I worked in an organ procurement organization and really understood how precious these organs are that go for transplant. And the individuals that receive these organs, they have to pass a medical screening to make sure that they're healthy enough to support the organ. And they go through a financial screening to make sure that they have the financial resources to ensure that that kidney is going to be viable for as long as possible. Supplemental insurance literally is the access to kidney transplant for dialysis patients. So we are very pleased that this bill includes a study provision looking at these issues for the under age 65 Vermonters who are diagnosed with end-stage renal disease. And I thank you for your time and urge your support of the bill. Thank you.
Elizabeth, just to be clear, I'm 50. I have end-stage renal disease. Now, my remembrance from when we were looking at hospitals, that is probably one of the most expensive diseases that adds to the cost of healthcare. It is very expensive. Those are automatically eligible for Medicare.
Yes.
But they are excluded from buying Medicare supplemental.
In Vermont, the statute explicitly excludes. Yes.
I have the feeling we did that over some concern about the cost impact. Are they eligible to buy other insurance?
They are eligible for Medicare Advantage. When Congress passed the 21st Century Cures Act, that opened up access for under age 65. But there are issues with Medicare Advantage, as you have heard from other testimony today. In a state that has a lot of rural areas, such as Vermont, network adequacy is a real concern. And not all Medicare Advantage plans cover the 20% out of pocket. They did when the plans were first available, but now more and more over time, there is an out-of-pocket requirement for these individuals, so it doesn't take care of that issue.
Okay, but Medicaid covers. So we're looking at those folks in that pocket between having enough money to pay out of pocket and not, and we're balancing that against the impact of picking up this expensive disease treatment for, on the market for everybody else. Okay,
And Madam Chair, one other factor to consider, the underage 65 is the prime age group for successful transplant outcome. These individuals want to re-enter the workforce. A lot of dialysis patients are just unable to keep up with their work schedules, but gaining a kidney transplant really is a second chance at life, and many of these individuals re-enter the workforce. We look forward to sharing additional data during the study portion that would answer a lot of those questions about cost and expenses and what would happen to the pool of the premiums.
okay. So committee, we are way behind. But I just found out that chairs has been moved to 4:30, so we've picked up a half hour. This, I think, is I'm gonna have this on the agenda later in the week.
I think Sarah had her hand up.
Sarah, how can I miss the big yellow hand? Yes.
I'm sorry. I just had an answer to the question about the birthday enrollment. I had my email a friend. So we are allowed to enroll someone 3 months before and 3 months after their 65th birthday. So if you are super prepared and want to make sure that you are enrolled in time, you can call and do so.
Okay. Anyway, I'm gonna have DFR in just to see if they can talk to us a little bit about markets. And then I think we just need to have some committee discussion about whether we feel we're ready to pull the plug and do a study, or whether we want to time that. I think we want to do something. It's just the sequence that seems to be in question. Okay, we're going on to 181 and 230, okay, 245. I did see Ellen pop up, but 181, is Tucker with us?
I've just emailed him. Patrick has joined us and Tucker will be with us in a moment.
Okay, and this is another one we're gonna walk through of possible votes. Hoping we have a couple of them up here at the moment. And Patrick, I'm not gonna ask you to give a financial report before we hear what it is, so I think we're waiting for Tucker to miraculously appear here on our screens. And then I'm told that S234 is a similar bill, and that one may have a fee in the underlying bill, which is not in the present bill, and we could dispense with them. Then we're gonna take a look at a couple of H bills, but I'm told that there is some urgency with 461 and asylum seekers, so I put that on the front burner. We did pick up another bill today, 161, which is, it's another health and welfare, I think.
Senator Cummings, I've scheduled that for 4:45 tomorrow night, S204.
That's got a, it's got a fee somewhere in it.
Which one is that? The ALS or the?
No.
Oh, the birthing centers.
The birthing centers, right.
And some kind of.
No,
The
pure
question
respite
is, are there
centers.
enough first to make them viable at all?
Well, Probst passed out 214. That's to the timeshare, originally timeshare bill just now. They kept it. They kept it.
Okay, good, with the
Yeah.
raise in the rates?
Yep.
Okay, that's progress, okay, good.
Senator Westman was a little surprised by how his bill had changed.
Yeah, well, We are the Senate. Wait till it goes to the House, it'll change again.
Sure it will.
Okay, it's
Senator Cummings, this is Faith again. I haven't heard from Tucker, but since Ellen is here, do you want to do 234?
Yeah, we'll go on to Ellen and S 234, and then we'll find Tucker. We can go back.
We did not.
The Medicare, no, we're gonna have DFR in and then I think extensive discussion. Okay, so Ellen, 234, an act relating to changes to Act 250, and they tell me we can have this in and out of here in about 3 minutes, which, given the title, makes me a little nervous.
This is Senator Bray's bill.
Yes, Senator Bray's bill.
Yes, and so I hope that is true because there is currently no money in this bill except for an appropriation.
Okay, I was told there was a fee in the underlying bill.
Oh, yeah, that's.
There was language in the underlying bill amending the municipal planning grant statute. However, that has been taken out. And so the other sections of this bill do not have fees associated with them.
Okay. My recommendation, committee, unless we want to get bogged down in looking at bills that are not in our jurisdiction, but having not seen what's in the bill that is not in our jurisdiction, that we could just pass it out without recommendation because there is no fee. Would that work?
Yes.
Then if someone says, how could you vote in favor of that, we're saying there just was no fee, so we passed.
No, we haven't read it. Of course we can vote.
No, we haven't read it.
Should we, should we hear what it is?
You want to walk us up? Well, have we found Tucker? We haven't found Tucker, so we got a few minutes.
The link doesn't work on our.
It doesn't work, yeah.
Yeah,
Oh, the link doesn't
so
work.
I'm trying to get to the bill and then others are playing.
Ellen, can you share the bill with us? Or can? Because the link that was not working.
Are you saying you would like me to put it on the screen?
Yeah, can you put it on the screen and just give us the
Okay.
25,000 foot overview?
Sure. One moment.
Is this stuff we've seen before?
What's that?
Is this stuff we've seen before? Like this Act 250 stuff, is it the same stuff? we've seen before?
It's similar.
Faith, let us know when Tucker appears.
Yes.
Okay,
Will
it
do.
was, the bill was voted out of Senate Natural Resources on Friday, February 25th. So it's on their website on that day. And I can put it up on the screen. It is 24
There
pages.
it goes. All right, we've got it.
So
Make it a little larger and just tell us a few things that it does.
sure. So the first few sections are municipal zoning sections. Can you still see my screen? Sorry, I'm clicking around here. So there's language amending the neighborhood development area program and the requirements for an area to be designated as an NDA. Then in section 2, some similar language is added to the new town center designation program to update that language as well. And then section 3 amends the municipal land use permits for municipalities and sets and states that no site plan permit or conditional use permit can expire in less than 2 years.
Okay. Liz, the screen is not updating. We're still
Yeah.
seeing section 1.
Yes, I didn't want to blind you because I just went through 10 pages pretty quickly, but did you want to see the language?
Just this scroll it through this.
Sure. So NDAs, now multiple towns can file joint application for an NDA. There's also language allowing flood hazard areas to be part of an NDA. It then requires that towns adopt ANR's model bylaws on flood hazard areas if they're going to have them in their neighborhood development area. It then removes the requirement for an NDA to have municipal sewer infrastructure or an alternative community system. And it updates the language on the required density for a neighborhood development area. Section 2 adds that required density language to the new town center designation program. And Section 3, as I mentioned, says that no site plan or conditional use permit can expire in less than 2 years. Section 4 raises the cap on the number of units in priority housing projects that can be exempt from Act 250. Currently, the lowest cap is 25 units. It raises that to 50 units for the smallest towns. It also creates this provision that says that priority housing projects constructed primarily using ARPA funds need to meet a higher requirement for affordability. So they need to be mixed income, containing at least 80% of the units being affordable for not less than 30 years. It then updates the definitions in Act 250 related to flood hazard area and river corridor, and the definition of mixed income housing. Next, in Section 5, it updates Act 250 Criterion 1D. This is a piece of language that's been floating around for a long time to match the ANR's definitions as they're currently used for flood hazard area and river corridor. Section 6 requires municipalities to respond to Act 250 applications within 90 days, or there will be a presumption that there is no unreasonable burden under Criterion 6 and 7. Section 7 adds new definitions for forest blocked and connecting habitat. Those definitions are then used in Act 250 Criterion 8. So there's a new sub-criterion 8C that adds applicants will now have to demonstrate that there's no undue adverse impact on forest blocks, connecting habitat, or rare and irreplaceable natural areas. If there are impacts, they need to be avoided, minimized, and mitigated in accordance with rules adopted by the board. So Section 9 directs the board to adopt rules defining what that means. Section 10 directs ANR to update their maps to include forest blocks so that they can be potentially useful in the Act 250 process. Section 9 revives a new an Act 250 jurisdictional trigger that used to be a thing, but was repealed in 2001. It used to be known as the road rule. So this now states that roads or driveways, either 8 feet in length or in combination 2,000 feet. I'm sorry, let me take a step back. This is adding a jurisdiction under Act 250 that states that a single road or driveway greater than 800 feet or in combination of greater than 2,000 feet will trigger Act 250. So roads and these are private roads. Roads used for municipal or state purposes are not part of this. So private roads larger than 800 feet or 2,000 feet in combination will trigger Act 250. There are new definitions related to wood products manufacturers, and those definitions are then used under Act 250 to set specific permit conditions for wood products manufacturers to allow them to operate outside of normal business hours, including nights, weekends, and holidays during the winter. Section 14 updates Act 250 definition of development. This language is based on the Snowstone case that happened in the fall. So this is changing the jurisdictional trigger for 1-acre towns to match the language for 10-acre towns. And then there are a couple of reports in here. First, it asks the Natural Resources Board to report back on whether or not there should be different jurisdictional triggers for agricultural businesses. That's a concept that's being considered currently in the House with accessory on-farm businesses. So it's asking the NRB to report back on that issue. Section 16 is a report on the designated area program in Title 24. That's the program that has the downtowns, new town centers, neighborhood areas, etc. So it's a $150,000 appropriation to hire a consultant to do a full overview and review of the program and recommend updates and changes to make it more consistent.
Okay, so this is going to approach, right?
Yes.
So that means we should get it out of here as soon as we can.
Yes. And finally, there is a study committee asked for 8 members of the legislature to consider the structure and function of the Natural Resources Board and whether or not that should be changed or updated. And that is it. And there's effective dates, but.
So committee, Senator Brock.
It seems like this is a bill that shouldn't have come to us in the first place.
Yes.
And the question is it from simply saying that we've gotten the bill and voted out without action, should there be a parliamentary procedure in which we refer it out of this committee because it would refer to erroneously?
Well, I think it's going to approach on Rule 31.
Yeah.
So and we
I'm just
can,
saying, just from a procedural standpoint, why should we vote something out there?
Yeah, I think the thing is we voted out without recommendation.
I just wonder if there are things in here that are changing permit things. Does that
That's not us,
change
Not us.
any fees associated with the permits?
not here.
I mean, I was just wondering if that was why it came to us, because of the.
So
Perfect.
we reached out, Faith and I reached out to the Senate Secretary's office to get a verification of why this was done here. Their reading was that the underlying bill was amending the municipal planning grant program, which would have impacted fees. And that language is gone. So they didn't address. I think the only thing maybe you could potentially say is here you're adding a new jurisdictional trigger. So that potentially would mean that there would be more people who need to apply for Act 250 permits potentially. So potentially there could be more Act 250 fees, although we haven't had much testimony on what that would even look like.
We also, doesn't it make more exceptions? Which would.
Development and neighbor development areas are now exempted, so.
As long as that's
Potential.
There, so the only slight exemption change is that it's raising the number of units that can be exempt from Act 250 under the priority housing project. So currently the cap is 50 units, or 25 units, and it's being raised to 50 units. But it's not a new exemption.
But we are not changing the fees, we're changing some of the rules of who has to pay them, which may or may not, in the end, affect revenues, but we aren't changing any fees. So I'm ready for a motion. Okay, Senator McDonald has moved that we vote the bill out without recommendations.
So just so you know, we have a bill coming here tomorrow that has most of the same provisions in it, so you're doubling down on this decision.
Doubling down on
I reserve my
we'll make
right
that
to change
decision
my mind.
Most
tomorrow.
favorite is
Okay.
supposed to have-
Further discussion on this one. If there's no further discussion, all those in favor say aye.
Aye.
Opposed say no. That carries 7-0-0. That was really hard. And Senator Bray, would you like to report that?
Sure.
Thank you, bye.
Oh, I hate to think about what it's gonna take to get something out that needs a decision.
Madam Chair, do we have to do anything to not lose a legislative day to get it to a vote sooner rather than later?
There's no way around it because we got referred, so
We've got,
even without a recommendation, I think you bring it up seriously.
yeah, I think you need to.
Oh, yeah.
Notice.
Yes, but
you can refer,
But the token session tomorrow
It'll pass.
will do that. It'll, right? Does it come off in notice? Gets referred
If
to?
we get it up, it'll go on notice tomorrow and come off
The enthusiastic.
Thursday.
Thursday, I think you're right.
Okay, and Thursday is gonna be really heavy. Senator Bray, I just get it upstairs,
I think you're gonna love it.
and the original bill is in this top file drawer, unmarked.
I'm sorry.
The original bill, Senator McDonald will get it. I hope it's made it in there, is 234, they're in order, Faith tells me. And just go off and write the sheet and get 700. Okay, Tucker is with us, so let's go back to 181 and hope that goes as well. Okay, Tucker, welcome. And just tell us what this bill does, why we have one on miscellaneous regulatory authority and municipal government.
Good afternoon, everyone. Tucker Anderson, Office of Legislative Counsel. S-181, taken from the 50,000-foot view, adds new municipal regulatory authority that can be adopted pursuant to an ordinance at the local level. It provides authority for municipalities to remove abandoned and damaged vessels from bodies of water within the state. It allows municipalities to suspend for a 3-year period charter-specific provisions in order to take advantage of a later enacted general law. It changes some of the election terms at the local level for specific local offices. And finally, there's a large block at the end of the bill that deals with the lessons learned related to municipal governments and municipal utilities resulting from the COVID pandemic response that are built into effectively new emergency preparedness sections. The one section of the bill that deals with finance-related issues is Section 7. Section 7 amends 24 VSA Section 138, which is the current general law governing the adoption of local option taxes. I believe it was last session or the session before, I walked you through a proposal for a universal local option tax. Well, that is what this Section 7 does. Under 24 VSA Section 138, a municipality can vote at a townwide election to adopt a local option tax of 1% on sales, rooms, meals, and alcoholic beverages. However, in order to qualify under this statute, a municipality has to meet a set of criteria based on the financial position, essentially, of the town between 1997 and, in some instances, 2000, depending on the particular criterion that we are talking about. These were known popularly in the past as the gold towns. This amendment strikes all of those limiting financial criteria so that any municipality in the state of Vermont could adopt a 1% local option tax on sales, rooms, meals, and alcoholic beverages.
Senator Hardy.
Clarification, Tucker. So this, under current law, the gold towns are not allowed to do a local option tax of any kind? And this allows them to do a local option tax?
Those towns are allowed under current law. It's the other 210 municipalities that did not qualify that would now be able to. I think there's something like 45 towns that meet the standards in this statute. And now every other municipality in the state would have authority as well.
Other towns have had to come in and get a charter change to enact the local options tax.
But Gold Towns have been able to do it without?
Yes, it was part of Act 60, and it was a way for them to make up the revenue that they were losing, since many of them were resort towns,
Yeah.
to make up for local government, the money they were losing by sending a property tax to the state. Over time, other towns, mostly small cities, have come in and gotten permission. I personally came in twice and never got it taken up by the Montpelier passed the charter change, and it didn't get taken up until third and fourth time.
Okay, so any town that currently has a local option tax that is not a Gold Town has had to come in and ask for that specifically. This would just allow any town to, but there's still a provision for voting a local option tax. I guess I should be asking Tucker that. If a town wants to impose a local option tax, there's a town vote to do so, is that correct? And then the purpose for what it's used for has to be approved as well, right?
For the first part of your question, yes, both under current law and the proposal you have in front of you, there would have to be a townwide vote, either to use the general authority or to approve a charter amendment. For the second part of your question, where the town puts its share of the local option tax, they do not have to put in the townwide vote. The general law guides the share between the state and the municipality, and then the municipality, when it gets its share of the revenue, can designate it according to its budget and policies.
Thank you.
Okay, and the percentage is what? There's a fee that goes to the tax department to administer it, and there's a percentage that went to all. It went into the fund that went to all towns. So Patrick, maybe, I'm assuming those are still in place, but.
Yeah. So Pat Titterton from the Joint Fiscal Office for the record. So the percent breakdown you're talking about, so as it stands, 70% of those funds that are brought in from the local option tax are retained by the towns. And then the remaining 30% goes into a payment in lieu of taxes fund, so a pilot fund. And that is, what you were alluding to before. Those are payments that the state will make to towns in towns where they have state properties or lands that are not subject to either municipal or education property taxes. So it's a way of making them whole in that sense.
Co-pilot.
So,
yeah, it goes in, there's a fund, if you have a state salt shed, a garage, a forest, any tax exempt state property, you can get a payment in lieu of, and that hits most towns.
Yeah.
Best we can do. Okay, Senator Brock, did you have a question?
I'm sort of thinking out loud, but I need to follow up. Are we going to vote this out today?
We don't have to know.
If we can vote for tomorrow, because I want to consult with the tax department on an issue related to this.
Okay, I have one question, and maybe you will invite the tax department in. Right now, when I file my sales tax, I have to do my sales tax, and then there are all the other towns for my sales in those towns.
Mm-hmm.
If all the towns in Vermont do that, it might be a very long tax form. But since it's all online, maybe that doesn't matter, but I'd like to ask them what that might do to their.
The question that I have relates to a specific situation. We have a multi-state chain that has a mailing address, St. Albans, but it is physically located within the town of Swanton. St. Albans has a 1% local option tax. Swanton does not. This particular company for a number of years has been charging the 1% option tax that they are not entitled to. On the basis of some constituent complaints, I notified the tax department of that, and presumably they did something because within 2 weeks of that notification, they stopped adding the extra 1%. There's a provision the tax department has in which a taxpayer can get a recovery. The business can get a recovery if they overpaid the tax to the tax department. There's no such provision for the end user. The question is, should that be something that we put in law, possibly as an amendment to this or something else that we're dealing with?
Yeah.
Because in this particular case, if I do a rough calculation of the average sale of a store of this chain and multiply it by the number of years involved, this is about $500,000 in taxes that were overcharged to consumers in my district.
I know.
So what do you permitted?
Well, that we will have.
So the other-
That's another issue for the tax department. They're aware of it, whether, and of course, they can't tell me whether or not they have done anything about
Okay,
that.
so we will put this on. I'd like to just know if they have any issues with this. And
Sure.
you can probably get your question to them early, so they have a little time
Yeah,
to
I'll-
research it or tell you they can't tell you.
Are there other sections of the bill that are relevant to us? There's something about ratepayers and public water systems.
No, we don't do that.
Didn't we do that last time, that when somebody can't pay their utility bill?
Oh, it's utility. Yeah, that, but that was the that was the COVID relief money for, there was money there to pay your utility bill, but
Yeah.
normally we don't, okay, get involved in that. Okay, so Tucker will just talk to the tax department, make sure they don't have any real angst about this, and then we will get it on its way.
Madam Chair,
Yes,
if I may, just a consideration.
Patrick, we've missed you.
Sorry, just a consideration for you regarding the pilot fund. So for a long time, so every year the tax department comes up with an estimate for the sort of reasonable or true value of what those pilot payments should be. And for a long time, the payments have been below that estimate. So in a sense, pilot's been underfunded for a long time, although in the last 2 or 3 years, they've been making up some ground. It's been about $2 million underfunded over that stretch. And so one thing you might keep in mind is, if there was a significant uptake in towns for, new towns adopting local option taxes, you could actually swing in the other direction and be overfunding pilot. So, you could consider either changing the share if that were the case, or what it would be, whatever you'd want to do. But if there is a significant uptake here, you could see a situation where you're overfunding the program.
Yeah, but if we're running 2 million under, we're gonna have to have quite an uptick to.
Yeah.
We'll have to do something about the deficit if we get an uptick. So.
I would overfund the immediate.
We can always raise the rate. Okay. All right. So we will put that on.
Just a question, maybe it's a question for Tucker, but this is gonna come into play around cannabis retail. And so, are towns permitted to enact a local options tax on a narrow slice, like I think they are? They could do just liquor in a restaurant or just cannabis at a retail. That's what I'd like to understand, because we better be clear.
It's rooms and meals is one set, and then sales, but I don't know that you can say we're only going to tax bourbon.
No, but I believe you could. I'm pretty sure that Burlington has a bigger tax at the bar than they do the restaurant, but I could be wrong about that. But the point is, can municipalities slice and dice, or is it sort of, you get a 1% wherever we have a sales tax or meals and rooms? You know what I mean?
So the way that subsection B is written is that they can adopt one of those subdivisions, but not all if they want to. And the way that it's broken up is sales, meals and alcoholic beverages, and rooms. Now, the authority that's lacking here is to say that only alcoholic beverages sold at restaurants versus bars versus, whatever licensed establishment are taxed the 1%, but these other sales of alcoholic beverages are not. So it's a take it or leave it proposal here. They're either putting a 1% sales tax on sales, meals and alcoholic beverages, or rooms, or potentially all three, if that's how they're proposing it to their voters.
But Burlington might be different because you're special. Your charter gave you the right to regulate places habitual.
Burlington is special, I agree with you, it's on the record.
So what's the problem? That's one thing. They predated.
They predated
a
this, so
restriction that was
yes.
subsequently passed after Burlington's course was
Well,
farm.
should we consider that? I mean. All right. It's a shame to, charge people a sales tax on their toilet paper when really the municipality is excited about their cannabis. 70% of 1%.
I don't think you have toilet paper.
Well,
Staying within your character here.
yeah, well, I'm typecast, I might as well own it.
Yeah. Okay, so I'm gonna move us along because it's taken us longer than anybody anticipated to two very simple bills. And we're going on to 461. This is H, House Bill, an act relating to excluding the income of asylum seekers and refugees from household income. So Abby is, there you are. Can you walk us through this? I've been told that there's some urgency with this bill. So can you tell us what it's solving? I know that finding financial stability for asylum seekers, that it takes at least one and maybe several years to even have your asylum taken up in the courts. You have to go to Boston, and you can't work for 6 months after your asylum is either been granted or been taken up, but there's very strict working conditions for asylum seekers. I don't know refugees because I haven't dealt with them, but is this the household income for property tax? Is that what's going on? Okay.
Yes, so I'd be happy to walk the committee through the bill, which the language itself is very short, but there's a lot to say about the few words that are in it. So for the record, Abby Shepherd, Office of Legislative Counsel. H461 addresses several different types of immigration statuses. So I will start by just laying out what current law is, what the bill does, and then I will give you an overview of those all the different terminology for immigration law that's in here, and then we can take questions from there. So to start, we are just talking about the homestead property tax credit. This does not relate to renters or the renter credit at all. I think it was Act 160 2 years ago, and that just took effect in this year. For renters, the renter credit was totally divorced from the household income definition. So this bill really this bill only applies to homeowners and their property tax credit. So under that statute that sets out the property tax credit definition of household income and household members, only one household member may claim the property tax credit, and all members of the household must be included in that property tax credit claim. That means that individuals under current law who are seeking asylum, who are refugees, or who have humanitarian parole, if they're living with, for example, a Vermont homeowner, or if they themselves were a homeowner, their income would be included. The genesis of this bill was host families who have asylum refugees or parolees living in their home, realizing that when they went to claim their property tax credit, if that individual living in their home had any income, they had to include that on their household, their homestead declarations on their household income form. So the types of income that those individuals are receiving could be from wages, but it could also be from public assistance. The household income definition does include support money other than gifts received by the household in excess of a total of $6,500 in cash or cash equivalents, or cash public assistance and relief. So it is possible that individuals do have some sort of streams of income. Under current statute, there are two types of housing arrangements that are already excluded from a household. So if a person is residing in the household under a written home sharing agreement pursuant to a nonprofit home sharing program, that person will not be considered a household member, but they cannot, oh, I'm sorry. Not used to being in the office. Sorry about that. That individual does have to have their income included, but they must be unrelated to the homestead owner. Also, a bona fide employee residing in the household, providing personal care to a member of the household, will be excluded, but again, they have to be unrelated. In terms of what the bill is trying to address is the exclusion of income received by household members who are humanitarian parolees, asylum seekers, asylees, and refugees. It does provide some limits to that. Those individuals' incomes may only be excluded from household income until the point when they become eligible for permanent immigration status, so lawful permanent residency. A few sort of consequences to note the way that the language is drafted. I'm sorry. Let me just mute for a moment. I'm sorry about that. So back to the consequences are that it does not require any of these individuals to be unrelated to the claimant. So that is unlike the two existing exclusions for household members. And it also could theoretically exclude income of an asylee, refugee, et cetera, if they themselves are the homeowner. That's more of a theoretical possibility. It's probably not likely that they are a homeowner, but it is possible. So that's section 1. Section 2 are the effective dates, which changes, which applies the change to the definition of household effective on January 1st. So it would be for last year, so that it would apply to homestead declarations filed this year. I'm just going to.
You're the most popular member of Fletch Council.
Yeah. It's highly unusual for me, actually. I get very few phone calls here. So that would apply for individuals who are applying on this year's homestead declaration. So I'm going to pause there, and then I have a lot of information about who these individuals are, what these different statuses are, and I may have to get back to you on some answers. I do have information about how long individuals are in these statuses, but I am, as you know, I'm more of a tax attorney. I'm definitely not an immigration law expert, so I would encourage you we do have Becky Wasserman in our office who is specialized in this area, but you might wish to hear from others on these, on sort of the context for immigration. So I'll just pause there if there are any questions.
Okay. Senator Bray.
Ms. Shepherd, I guess the basic question I have is, do you have information that suggests to you how the funds coming into these individuals are being spent? You know, like, I guess on sort of a simple level, I can imagine that funds being allocated, gifted to these individuals are to help them create a new life. And so that entails a lot of expense versus if you're staying with someone and you're expected to contribute to the household income because that's where you're gonna Like when a child moves back in and now they start contributing to the expenses of the household they've rejoined. And this, I'm just trying to distinguish over if the money's coming in, if there's any way in which they're different than ordinary income. Like someone might say, well, yes, I have these funds, but I'm really getting ready to leave this temporary housing situation and set up a new home for myself. So to the degree to which I contribute to this household, I'll be less able to establish myself outside once my asylum status, for instance, is resolved. I'm trying to figure out the reasonableness of expecting to apply that to household income versus saying this is a truly different situation, and that's why we might exclude the income.
I think we might want to get some tests. There's several groups that are working to resettle immigrants here. I've worked with one group in central Vermont, but I think it would be, that question might be better answered by those folks as to what is, there's always an exception somewhere, but what's the norm? Well, how long do these people live with a family? Do they pay rent? In my experience, they don't. But
Tracy Dolan heads up the refugee office for the state. She used to be at Department of Health.
there is a refugee resettlement program, I believe in Burlington.
Or there's a state office.
And we will find those folks. And then there's, I don't remember, but there is a group that has been settling asylum seekers from Latin America. And I know there's a group that's been resettling Syrians. They're very active down in the Brattleboro, Rutland area. So I think that we might just do that testimony one day.
I withdraw the question until I know more about what's going on.
Maybe we should ask Julia to give us a,
what's the universe?
what's it gonna cost us? Then we'll know. So Julia, what's the fiscal note on this one?
Good afternoon, Julia Richter with the Joint Fiscal Office. The fiscal note that I drafted should be under my name on the committee webpage. And so we estimate that this bill will decrease education fund revenues by a maximum of $150,000 per year. So this represents a loss of less than 0.01% of all education fund revenues. And we anticipate that this proposal will have a de minimis effect on tax rates and yields. I'm very happy to talk in more detail about my analysis to reach this estimate or answer any questions the committee may have. I will also add, we did touch base with the State Refugee Office and spoke with Tracy Dolan. One of the major challenges in terms of understanding the income levels and some of the more, I guess, specific data points is because there are so few refugees, and B, not all of the data is collected regarding them. Some of this very specific questions, just the data doesn't exist, but yeah, we estimate 150 overall maximum.
150,000.
0.010. What was the percentage, Julia?
Less than 0.01% a loss.
Okay. So committee, this one is an H bill, and I'd kind of like to get our first walkthrough of 510, which is a bill that I think we may spend a fair amount of time on, which is the Vermont Child Tax Credit and Social Security income exclusion. I don't know about Social Security, but I know the child tax credit has a big price tag,
But that's it. I'm sorry, you said age 510?
510.
Yeah.
Yep.
That's, I guess I'm confused because that's an H bill and we're cranking on all these.
We are just what,
Okay.
we scheduled the S bills that we had, and then we started
Yep.
moving in some H's. If we start running out of time, we'll kick the H's. But the S bills so far have been pretty simple. So we thought we'd start moving through because some of these are not gonna be as simple. So Abby, you're there, and Graham and Patrick. Yeah, see, we got two joint fiscals, so. Can you put that bill up and walk us through it? Because this, I know, this is the main work, I believe, from Ways and Means this year.
Senator Cummings, this is Faith. You also have copies by your side if you want to hand them to the committee.
Yes, we do. They're down, probably 3 bills down.
510 it is?
Yep.
Would you like me to share my screen, Madam Chair, for H510?
I think that helps.
Okay.
I think it's
would
if we're all looking in the same direction.
Would you like me to share the section by section or the language of the bill?
Let's start with the section by section.
Great.
Because this is our first walkthrough, so let's find out what the bill does and then. There.
Great.
Okay.
Is that big enough for the committee?
Yes,
Okay, great.
it is here. Good. All right, we have the section by section.
Since we're talking about kids, can I do a little thing?
Baby.
Oh, man, no fair.
That's our first minor grandchild,
Oh, congratulations.
born at the end, like midnight Thursday night.
Oh.
What are you doing?
Very exciting. And now it's
Whatever.
You're a grandfather. That's amazing.
Boy or girl?
the
Brock.
girl, Emily.
Emma?
Congratulations.
Amelia, who's already called Emmy.
Just got
Okay.
Come on, people,
When we're
I made
finished
little
the
packets for you.
Through, get your packets, and we're gonna walk through, and then I can brag in my grandsons that place first and third in the regional swim meets this weekend.
Oh.
So that's your language.
Okay, so have you got one, Michael? All right, we're gonna go through and it's on the screen. We're gonna go through the section by section. All right. Average.
Excellent. Okay, so for the first section so this bill is H510. It's a bill creating a child tax credit and changing the Social Security benefit exemption. Most of the sections relate to the child tax credit. Section 1 adds a new section of statute that creates a refundable Vermont child tax credit. For a bit of background, there is the federal child tax credit. There are only a handful of states that offer a state child tax credit. Vermont does not currently have a child tax credit, so this would create one. It creates a credit of $1,200 available to residents or part-year residents who are themselves already entitled to a federal child tax credit. I've put a note here that if it were a part-year resident claiming the credit, the amount of the credit is prorated by the amount of their non-Vermont income. The $1,200 credit is per qualifying child as defined under federal statute. So this language refers back to a couple of different federal sections that lay out how the federal child tax credit works in terms of what a qualifying child or who a qualifying child is. It's typically the taxpayer's dependent. The child can't be a dependent of someone else. It does allow for claims for foster children and adopted children. And if you want, I would have to stop sharing my screen because I have the statute up on another screen, but I could give you more detail if you have questions about that. Under this bill, unlike the federal child tax credit, H510 does limit it to children 6 years of age or younger. And that's as of the close of the taxable year. So for example, a child born December 31st would qualify in that taxable year. Or if they turn 6 on December 31st, they would no longer qualify in that taxable year. I'm sorry, if they turn 7, they would no longer be eligible. Yes, I'll pause because there could be, if you have questions, please stop me.
I was gonna ask about income limits, but it sounds like that's the next subsection.
That's next, yes.
Senator Sorokin has a question.
I don't know if you're going to get to this, but what is the qualifying requirements for the federal credit?
May I stop sharing my screen? I'm sorry, I didn't print anything out, so everything is on my screen. I'll just pause for a moment. So to be eligible at the federal level, an individual has to be, the taxpayer has to provide support for more than half of the year. For the child, it has to be someone that they can claim as a dependent. The child cannot be a dependent of anyone else. And there are different thresholds for different filing statuses. Married filing separately, for example, is allowed. Other credits don't allow that. Let's see what
Look at
else.
the income threshold.
You're more interested in the income thresholds at the federal level. So the federal level is a little more complicated because it was changed first under the Tax Cuts and Jobs Act, and then it was changed specifically for 2021. So I do have that information. I'm sorry, I'm just pulling through my various screens here.
Okay, but I think the next section too starts to talk about that, right? Is it receive 200,000?
That is for the Vermont credit. Would you like me to give a quick review of the federal? Because this is different from the federal thresholds. It sets out separate Vermont.
I guess I was just wondering, does everybody at this 200, generally, do most people at the 200,000 level, do they have an impediment in qualifying for the federal one? Or is the federal level higher or lower financially?
Yep, those are great questions. So for 2021, the federal threshold was 400,000 for married filing jointly and 200,000 for single filers, so head of household or single or married filing separately. The Vermont bill is slightly different in that it imposes the threshold is 200,000 for all filers, so married filing jointly or single filers.
Okay. Thank you.
Okay. So we're back to Vermont.
Yes, I will share my screen again. Give me just a moment. Okay. So that's in subsection B that imposes an eligibility threshold, and anything above that 200,000 of AGI, the credit amount begins to phase out. So it does have a phase out provision, and it's the same. It's Graham would have to provide the numbers exactly where it ends up being zero credit, what the income amount is, but it phases out $50 for every $1,000 of adjusted gross income above 200,000. That is sort of the basic structure of it. The next subsection, there was quite a bit of time spent discussing how this new credit might potentially impact other benefits or assistance received by taxpayers, because there are different rules surrounding what state tax credits are included in a taxpayer's income. Generally, because there are two different provisions, there is federal law that excludes federal refundable tax credits from benefit determinations. However, not all state refundable tax credits are excluded. There's something called the General Welfare Doctrine, which excludes refundable state tax credits at the federal level when they are provided for the general welfare. So they have to be based on need. So for example, this sort of credit that's aimed at lower income and it's for a family, for children, would likely meet that general welfare doctrine. Something that's more, a general credit that anyone could be eligible for, not based on need, would likely not be eligible to be excluded from benefit determinations. So this language is included to clarify that the intent of the General Assembly is not to have the credit included in any assistance programs as much as allowed, to the extent that is allowed under federal law. And under state law, it's a blanket exclusion from any programs. However, there is federal SNAP. The federal SNAP law does have a provision relating to reoccurring payments. So that does not allow those to be excluded. So for example, monthly payments in the way that the federal child tax credit was made would not allow for that income to be excluded federally. So this, just to be clear, this language does not create a monthly payment. But you'll see in the next section, it does require a report about a way to make monthly or other reoccurring payments that wouldn't run afoul of that federal rule against including or excluding that income for benefits. One thing to note is that the effective date for the credit would make it effective for the current taxable year, 2022, which means it would first be available when taxpayers file next filing season in 2023. And at that point, it will be paid in the typical way that tax credits are paid, as one lump sum. And I'm sort of setting you up because the next two sections do contemplate sending out an advance payment and then potentially creating monthly payments in subsequent sections of the bill. So in section 2 of the bill, it has a different effective date at the end for this section. It would add a new subsection D that would require the Commissioner of Taxes to make one annual advance payment of 1/2 of the credit on or before September 1st. Again, the effective dates push this out, so that wouldn't happen until September of 2023. And that would be an advance payment of 1/2 of the 2023 tax year credit. Section 3 is the statutory purpose. As you're aware, whenever there's a new tax expenditure, it needs to have a statutory purpose to be implemented and enforced. And the language states that the statutory purpose for this child tax credit is to provide financial support to families with young children. So section 4 does address, it requires a report requiring the Commissioner of Taxes and the Commissioner for Children and Families to report back to the legislature about how could monthly payments be made to taxpayers, what are the different administrative hurdles or considerations for structuring that, and then how to structure the payments in a way that won't violate that federal provision saying that non-reoccurring payments are not allowed, only lump sum payments for tax credits or refunds, including the option of securing a waiver for the federal SNAP program. And lastly, asking for any proposed legislative language. So I will pause there before moving on to the Social Security income exclusion, if there are any questions.
Any questions at this point? Not seeing any. Keep going.
Great. So as you're all very well aware right now, after just discussing the different options for retirement income exclusions, this bill made a smaller change to the existing Social Security income exclusion. It increased all of the adjusted gross income thresholds, both for eligibility for the exclusion and also for the amount that may be excluded. It increased all of those amounts by $5,000. It also made a small fix, which was not included in the language that you passed out, but is in, I believe is in the technical corrections bill. So regardless, that will be made. It strikes out a reference to different tax filing statuses. The current language incorrectly references qualifying widows or widowers, which is more relating to Social Security benefits, not to income tax filing statuses. So it just strikes that language and includes and inserts surviving spouses. So it's more of a technical fix. The effective dates, as I mentioned, it would make the child tax credit effective for this tax year, helping taxpayers in 2023. That's when it would first apply. Then the first advance payment would go out in September of 2023. And the report is due back to the legislature at the beginning of next session about how to make monthly payments.
Okay, Senator Peterson has a question.
Abby, there's nothing in here that for the Social Security income threshold, it's still static, right? But it's just increasing that static amount.
You mean it's not increased for inflation? Is that?
Yeah, there's no indexing or anything, right?
That's correct. There's no indexing.
What was there a discussion about that?
Not that I'm aware of. I don't know that I can really speak to that.
Okay, thanks.
Sure.
Okay.
Stop sharing my
Any
screen.
other questions for Abby at this point? If not, we'll go on to Graham. Oh, Senator Hardy.
So thank you, Madam Chair. A family can get more than one of these child tax credits if they have 2 or 3 children under 6.
6 or under.
Yeah, okay.
That's right.
Okay, Graham.
Thank you. For the record, Graham Campbell from the Joint Fiscal Office. I will share my screen here. Make sure I'm doing the right one. Can everyone see the fiscal note here?
Yeah.
On the screen?
You make it a little larger.
Okay. Is that better?
Better, yeah.
Okay, so again, for the record, Graham Campbell from the Joint Fiscal Office. I'll just go over the fiscal note. The summary of this, as Abby said, is there's mainly 2 large items. The first is the $1,200 child tax credit in the bill, and then there's the Social Security income thresholds exemptions that are raised $5,000. So in summary, we estimate that this will reduce state revenues by $49.7 million in fiscal year 23, growing to about $50 million by fiscal year 2026. The vast majority of that is the child tax credit. The child tax credit is estimated to be about $48 million. We think it's going to be relatively stable rather than growing or decreasing. Generally, the number of births in Vermont has been declining over the years, and so that would sort of forecast less child tax credit going out. But we just wanted to be conservative and keep it sort of flat. But the Social Security exemption threshold does increase in cost, and that's largely due to sort of 3 factors. First is the fact that Vermont has an aging population. The second is that the benefits for new retirees are always greater than those for the older retirees, because because Social Security benefits are paid relative to the wages that you earned when you were working. People retiring now had higher wages than they did back 20 years ago. And so the size of Social Security benefits is growing. And then thirdly, the federal exemption, which covers, a good chunk of Vermonters, those thresholds in the federal exemption are not indexed by inflation. And so essentially what that means is that more and more retirees are being picked up by the Vermont Social Security exemption. So going into some of the details and analysis for both these provisions, for the child tax credit, as I said, we expect that this will reduce state revenues by about $48 million. We forecast that it'll affect about 34,000 tax returns, and roughly 40,000 children in Vermont will receive a child. The children won't receive it, their parents will receive it, but 40,000 children are counted for the child tax credit. Table 2 gives you a sense of where we believe the taxpayers impacted will be based upon the income groups. And so it's really across the entire income spectrum up to about $200,000 in adjusted gross income. This isn't in the fiscal note, but generally when we look, and I can come back and go deeper into the child tax credit for the committee at a different time if needed, but more or less when you look at the distribution of children by income group, what you see in Vermont is that children tend to be there. Every income group has children, but what you see is sort of lower middle income families have children, a higher percentage of them have children, and then sort of in the $100,000 to $200,000 range, they have a high percentage of that group has children. But then after $200,000, the percentage of families that has children is very low. So more or less the story that I told over in the House was that changing the income thresholds above 200,000 does not really affect the cost too much, because there's just not very many wealthy families tend to be older, and older families don't tend to have as much children. So just a sort of fact for the committee as they think through this child tax credit. But we believe that this child tax credit, because it's refundable, will significantly reduce tax liabilities and effective tax rates for lower and middle income groups in Vermont. To give you a sense, for those with AGI under $60,000, if that family has just one child, then this child tax credit would more or less wipe out the tax paid by those households in Vermont. So just one child would be enough to wipe out the tax liability for families with AGI less than $60,000 on average in Vermont. And what it also means is that for families below that income level, because it's a refundable credit, they'll be receiving pretty sizable payments from the state. To put this into perspective scale-wise, the average earned income tax credit, which is the largest refundable credit we have, is about $690 per return that receives the earned income tax credit. Just having one child here is $1,200. So you can imagine a situation with a family with 2 children really wiping out any tax liability they have, but then also receiving a large payment from the state. So as Abby said, the bill is effective for tax year 22, which means that taxpayers, when they file their taxes in April, will receive a child tax credit. And then going forward in tax year 23, taxpayers will receive an advance credit of half of the credit in September, and then the other half will come when they file their taxes in the following April.
Okay, Senator Sorokin has a question.
I don't know if this question is for Abby or for you or for the tax department, but how easy do we make it for people who wouldn't otherwise be filing a tax form, a tax filing to get this credit? Is there a simple form in the tax booklet that you envision, or how does it work for the EITC or the renter credit or any other refundable credit? Do you have to file like a long form to get the credit?
So there's nothing in this bill, I don't believe, that lays out for non-filers. And it's unclear to me how they would access the credit, or even if they could. With the EITC, it's slightly different, because with the EITC, ours is just linked to the federal earned income tax credit. And in order to claim the federal earned income tax credit, you have to file. And in order to be eligible for the earned income tax credit, you have to have earned income of a certain amount that sort of would otherwise make you required to file taxes. And so it's unclear to me whether this bill would have anything, or whether the tax department is planning on doing anything to reach taxpayers who don't file. I don't know if Abby has anything to add to that.
Right? We'll have them in, of course, right?
Oh, yes, this is our first walkthrough.
So I would just add that, yes, the bill does not require the department to stand up any sort of program where individuals who aren't required to file would be able to take this credit. The language does predicate the availability of the credit on an individual being entitled to a federal credit, which is the same language that's used for the EITC. That said, there is the advance payment language. Again, that doesn't take effect right away, but that does require the department to provide for an opt-out, which is a slightly different issue, but would sort of address individuals who maybe aren't eligible for the credit. So I think the department would be probably the best place to answer that question, and how they would, the commissioner has authority to determine procedures and forms under existing statute.
I think the only other thing I'd add to this is that for the federal child tax credit in tax year 21, where there were advance payments non-filers, which again, we should define as non-filers, are generally those who have less income than the standard deduction. So federally, that's $24,000 and for a married couple and $12,000 or so for a single filer. The IRS set up sort of a non-filer tool to report children to the IRS, and that's how they got the credit. So I think it really is a question for the tax department whether they plan on setting up a similar tool for something like this.
Senator Harvey, did I?
Yeah.
Question that Senator Pearson.
So maybe this is defined in the cross reference in the bill, Abby, but, oh, sorry, this is maybe a question for Abby. I don't know, whichever. But what happens if parents are divorced? And is it the parent who is the parent who claims the child on their tax form, the one who would get the credit, or how does that work? Similarly, foster children or children who, maybe in a temporary placement or something like that.
Yes, so that is all contemplated under federal law. And I don't remember off the top of my head if that's within the child tax credit section. I think it's actually in the dependent definition, which is in a different section. There are quite extensive rules relating to both separated and divorced. There's legally separated and divorced parents and who can claim the child. There are also provisions about foster children, adopted children, and missing children. All of that is laid out in federal law.
Okay. Is that 26 USC blah, blah, blah?
So 26 USC is the Internal Revenue Code. And yes, it's section 152, which is the definition of dependent. And I can I can share the statute with you if you'd like, or I could do a summary of the different provisions. Let's see, it's about 10 pages of statute.
Oh, wow.
There's a lot of information. If you had a specific question, but I could also summarize it. There is a lot of very useful sort of plain language information on the IRS's website as well that I can share with you.
Okay, if you could just send that to me, then unless anybody else cares to, I'm just curious.
Sure.
Thank you, Abby.
Okay. Senator Pearson.
Abby, or Graham, I guess. What happens, how many people are, if you split it at $150,000, how many people are excluded? Do we have that sense?
No, I've not modeled that. So I can tell you that when this bill was going through the House, one of the original proposals was to do a different income level for single married filers, so 200,000 single and 400,000 married, and the total cost of that proposal was about $50 million as opposed to 48. And so we estimated that the number of children was just over 40,000, about 42,000. So about 2,000 kids, were attributable to the two married couples making between $200,000 in AGI and $400,000 in AGI.
Yeah, but I'm wondering how many are attributable to families making 150 to 200.
Oh, I'm sorry. Yes, sorry, I misunderstood the question. I don't know the answer to that. It's probably somewhere between. Yeah, I don't know the answer to that question off the top of my head. I have to model it out.
Okay. Senator Harvey.
Graham, I don't know if you have done any research analysis on what might be the secondary impact of this kind of, for example, we heard that the federal tax credits reduced child poverty by X% over the pandemic. Have you done any research on that to see, would this help create a decline in demand for other services because there's less poverty, or any other kind of ripple effects that you were able to analyze?
So I did not do an analysis of sort of secondary knock-on effects for state programs. So, would people be accessing various state programs? However, I did do research for the Ways and Means Committee about the potential effects of a very large child tax credit, but it was largely based upon the information that that was collected and analyzed for the federal child tax credit. So obviously the federal child tax credit is a larger tax credit than what's being proposed here. But the expansion of that federal child tax credit was found to bring, up, at least in the US, up to 6 million children out of poverty. There was a very large reduction in food insecurity as a result of that expansion. I'm trying to look at the data or what I prepared. There was another study that found that there was a small decrease in the size of the labor force, but that was because poor mothers were choosing to stay home as a result of the expansion. So they didn't feel the quote unquote the pressure to go back to go to work because they were receiving a large child tax credit. So there's still a lot of research going on around the expanded federal child tax credit. This is obviously not as large as that, but I think it's somewhat reasonable to expect, similar type effects, but not as large of effects as you would see relative to the federal one.
Okay, thank you.
Okay.
Madam Chair,
Yes.
do we have time for one more question? Or
Yeah.
it's not burning? I guess I'm not sure which of you this is for because it's sort of an intersection of policy and money, but Abby said that to the extent possible, we're trying to not have this $1,200 or $2,400 count against people's eligibility for other things. And on the side-by-side sheet, it includes general assistance, which I think is housing, right? I guess I'm wondering.
Partly.
Partly. Does a family have to take this? Or, I mean, I would hate to help somebody with this tax credit and then find that we made them ineligible for housing, and that's a much greater benefit than $1,200 a year.
I think that is more directed to me, Graham, but jump in if you have other things to add. So that's clearly the intention in the language, is for it not to impact. That's precisely the concern, and why that subsection was included, is to say that it will not impact any state credits. From the research done, it seems that the major concern is about the SNAP benefits, where there is that federal law that says you cannot, if you have reoccurring payments in anything other than a lump sum, that will be included in your benefit determination. In the other, both federal statute and then state statutes, where there is, like, Reach Up does have more discretion to the Commissioner for Children and Families to determine what's income. This would cover those programs so that the child tax credit would not be included in those benefits. So the main concern here is about the SNAP program. And as long as this is paid as non-reoccurring lump sum, which it is for the first year, it would not be included in those benefits.
Okay, thank you.
Sure.
Okay. So Graham, have you finished your presentation for us?
Just to the second part of the bill, the Social Security exemption.
Yes, send your break.
Sorry, did you do the not recommend bill? Did you work that upstairs?
Yeah, I brought it up.
Okay.
You were just.
And just
And
so
our
you know,
bills up.
I talked to Secretary Bloomer, he said they'll either be on because it's up already, it'll be noticed tomorrow, and they refer from the notice calendar. So
Okay.
no loss of time.
Great. Okay, we got one bill taken care of with no recommendation. So Graham, I apologize, the Senate Secretary was here. Walk us through where you started about a minute ago.
Yeah, no problem. So the second part of this bill is the expansion or the change in the income thresholds for the Social Security exemption. As a reminder, those thresholds right now are a full exemption for individuals under making below 45,000 in AGI, and married filers below 60,000 in AGI, and over the next $10,000, those are exempt out. This bill increases those by 5,000. So what you would have is any single filer with AGI below 50,000 would receive a full Vermont tax exemption on their Social Security benefits, and any married filer under $65,000 in AGI would receive a full exemption. And then the same $10,000 phase out remains. And we estimate that this will reduce state revenues by $1.67 million in fiscal year 2023. Growing about $100,000 every year thereafter. And we expect about 7,800 tax returns to be impacted by this, and the average tax benefit to be about $215 a year for those impacted taxpayers.
Okay, Senator Sarakin.
I don't know if Abby or Graham were present, but did you hear any rationale for doing this so close on the heels of just having established these levels?
Not to my knowledge. I think that might be a question for someone from the Ways and Means Committee. This was added, I think, towards the end of the bill. This bill was largely a child tax credit bill, and this got added shortly, towards the end of the consideration period, or I don't know how to say it, but it was sort of a late add to the bill.
It strikes me as a relatively minor tweak, and I'm just wondering why or what generated reconsideration of what we had already done. You don't know. It's okay.
No, I do not.
Several years ago.
Two or three, right? Two or three, yeah. Maybe it's an inflation.
Yeah, we'll have Ways and Means. Yeah.
2019, I think we did.
Yeah.
Not the first session.
My first session in the Senate. I think it was 2019.
Okay, so other questions? Are we headed through the day? I think so. Okay, we are going to spend a lot more time on this bill. We've got to get 181 out, and the Medicare supplemental insurance policies. That one's, we're going to have to get out by the end of the week. So
181 is the municipal.
yeah, it's option taxes. And we're going to hear from the tax department on that one. 250 changes is out. So, and we've got one or two other ones. There's a fee in the peer counseling bill. I'm going to have to, professional regulation in, but I think this is done by another peer group. But just to take a look at what the fees cover. That group isn't set up, so we can't have them in. And then the one we got today that also has a fee.
Doesn't it go through DMH?
We'll look at it.
Yeah.
And take a look at the fees and what they cover, and we'll, so it might be Department of Mental Health to have in. Okay, so those are two other ones we've got to get out. All right, thank you, committee. We can